Hello, we are Team 2. I am Jimena Marroquin, and together with my teammates, we will talk about a very important topic, which is the function of the lungs, which my partner Mariana Martinez will start.
Breathing is an essential function for life that we perform unconsciously. The lungs are responsible for making this action happen. But where are they? They are a pair of soft, pinkish grayish, spongy, elastic, and conical sacs that are covered by a lubricated membrane called pleura, which is a connective tissue membrane that prevents the lungs from breathing directly with the inner wall of the box thoracic. The lungs, right and left, are not the same. The right lung is larger than the left due to the space occupied by the heart. The lungs are divided in two lobes, the right one into three, upper, middle, and lower lobes, and the left one into two, upper and lower. Where are the lungs located? The lungs are located inside the thorax, in front of the spine, behind the sternum, and inside the ribs and are on the sides of the heart. All of this constitutes the rib cage, whose function is to protect them.
Now we will talk a little about the function of the lungs. Who doesn't know the function of the lungs? I honestly think we all know that the lungs have two main functions. The first function, get the oxygen from the air that goes to the body. The second, remove carbon dioxide from the body. But let's delve deeper into this topic. Our body needs oxygen to work properly, which is what the first function already mentioned above does. The second function eliminated carbon dioxide because it is a waste product that our body produces when it's used oxygen.
The next topic is one of the main ones that the public asks: what diseases are caused and how they develop. Chronic respiratory diseases comprise a group of diseases that affect one or more parts of the respiratory system and can compromise the bronchi, lungs, and ribcage. Among the most common are asthma, chronic obstructive pulmonary disease, COPD, pulmonary fibrosis, sleep apnea syndrome, pulmonary hypertension, and among others. From a health point of view, they are of great relevance for three reasons. They are very common diseases in the population, they can cause disability and abstain from work. Many times they are not diagnosed correctly. The most common causes are exposed to respiratory system irritants such as tobacco smoke main cause, air pollution in closed spaces, home, workplace, environmental pollution, exposed to allergies, inhalation of dust and chemicals in the workplace. Some may appear as a secondary manifestation of other diseases or be caused by some drugs.
Now let's talk about the lungs are made of soft, elastic, spongy tissues and they are pink. It is easy to imagine its structure because it's made up of alveoli, bronchioles, and bronchi, and it's known as the bronchial tree. The lungs also contain elastic tissues that allow them to inflate and deflate without losing their shape. They are covered by a thin layer called pleura.
A lung transplant is a surgical procedure that involves placing a lung affected by disease or that is not functioning properly with a healthy lung. An opening of the dry chest is made. First, one diseased lung is removed, and this place the first donor's lung is implied, performing anastomosis of the bronchus, pulmonary artery, and the left atrium flash and includes the veins of that lung.
Now, let's talk about normal breathing rate. Normal breathing rate can vary depending on a number of factors, including age. Infants up to 6 months of age, between 30 and 60 breaths per minute. Children between 1 and 5 years of age, between 20 and 30 breaths per minute. Adults between 12 and 18 breaths per minute. Remember that if you have any problems with your breathing, you should consult a doctor.
The topic is, the human can survive with only one lung, and the answer is yes, because the body have the ability to adapt and compensate with only have one lung, but while having two lungs is ideal for respiratory function. A single healthy and functional lung can provide sufficient oxygen to the body. The remaining lung can expand and occupy some of the space left by the missing lung, allowing for adequate breathing.
Thank you for your attention.